Hello, I'm Corporal Hayek with the San Diego County Sheriffs Department. Are currently assigned to our Homeless Assistance Resource Team, or short for H.A.R.T team, and I'm also a crisis negotiator, more commonly known as a hostage negotiator. I am currently assigned to the Fallbrook area, so our H.A.R.T team is broken up into a South group and a North group. So our North group covers Fallbrook, Bonsall, Unincorporated Vista, Unincorporated Escondido, San Marcos, Ramona, and all the way out into the rural areas. Down south, they do any unincorporated area in the South County. So prior to this, I did 3.5 years in San Diego Central Jail as a deputy there. Then I did 4 years, a little over 4 years, in Vista Patrol. An opportunity came about for me to join this team, and I put in and ended up getting it. I started the team last year. I chose to do the homeless outreach team, especially here in Fallbrook, because I live in this area. I want to see this community thrive, and I want to help the people that I live around. So I joined the H.A.R.T team to work towards better solutions to our ongoing homelessness crisis. The homelessness crisis has so many different aspects to it. It's mental health, drug abuse, low incomes, and inflationary rates, and even the elderly who can't afford some of the housing, they end up on the streets. So there's so many different aspects to homelessness that the general public doesn't always see, and I wanted to be part of a solution and work towards bettering our community. I've worked for a long time seeing people on the streets struggling with drug abuse and mental health, and I saw while working in the jails, I saw them coming into jail over and over again for very similar problems. They can't get out of their cycle of drug abuse. They have mental health issues, and oftentimes they're self-medicating with drugs to try help to overcome those factors. The institution of the H.A.R.T team, we bring a lot of tools to the table. Part of our program is to work with social workers, mental health, psychiatric clinicians, commonly known as PERT team. PERT stands for Psychiatric Emergency Response Team. So we've came together as a group working with law enforcement, social workers, code compliance, and nurses come out with us, provide vaccines. So the H.A.R.T deputies, along with the social workers in our team, our combined team, we often locate people that are experiencing homelessness through referrals. So you can send a referral to heart.team@sdsheriff.org. You can also contact any of your local substations, sheriff stations. I take referrals through the station. Additionally, we are out there 4 days a week trying to contact people in a state of experiencing homelessness. So usually on Mondays, we'll be out hiking the various green belts, looking for people that are not often contacted by the general public and by social workers. So we try bringing them resources wherever they're located. The other days of the week, we have nurses, social workers, and various other people that help with homelessness. We go out as a team and identify and locate various encampments and people. We are a non-enforcement team for the most part. Our goal is to build relationships with these people and work towards the goal of ultimately getting them off the street and into housing. Our primary program we use is called EQUIS. So usually we go out as a team and locate someone experiencing homelessness. We get their information and we work with them with a social worker to provide them food stamps or general relief or any other resources they might need that day. Moving forward, we take their names and get them in touch with EQUIS. EQUIS is a housing first program, so we provide them with a hotel voucher for a short period of time. while they're working towards Section 8 housing. While they're in the hotel voucher program, they get assigned a housing navigator to guide them through getting into a Section 8 and getting off the streets. We also provide wraparound services. So once they get involved in our programs, we encourage them, if they have substance abuse, to go to programs and get the help they need. We also help with mental health evaluations and moving forward. I'd encourage the public, if they see an encampment or various other places where you see a lot of homeless people congregating, not to try addressing the issue yourself. We are a professional team. We're not in there to try getting them in trouble, and we're there to improve their lives. With that said, some people who have mental health issues and are on drugs can be very unpredictable. And I want this public to be as safe as possible. We're trained experts. I've had hundreds of hours on communication training. I've had many hours on identifying mental health and substance abuse. I'm trained in ways of keeping myself safe and keeping the team safe. So if you run into these encampments and you want it addressed, reach out to the homeless outreach team. We'll go down there and work towards solutions of taking care of any encampment and bettering those people down there.